All right, we're going to look at LaMelo Ball's re-injury of his left ankle against the Pacers in the NBA. Looking at the footage, LaMelo lands on a spectator's foot, forcing his ankle into a typical mechanism of injury for the lateral ligaments, where his foot plantarflexes and inverts. This is a usual mechanism for those lateral ligaments and gives us a clue to kind of diagnosis. In this case, lateral ligament damage and possibly some medial compression of the actual talus. This is what we call inversion injuries, and they're at least 4 times more likely than eversion injuries due to the relative instability of the lateral joint and the weakness of the lateral ligaments when compared to the strong medial side. Lateral ligament injuries often occur in these sports involving rapid change of direction. In this case, LaMelo's pretty unlucky, landing on a spectator's foot, forcing his foot into that inversion position. The ATFL is the ligament that's usually the first ligament that's torn, and it's usually torn in more than 95% of cases. This is because the ATFL is pretty tight or taut in that plantar flex position of the ankle. And the CFL, which is a ligament that comes off the lateral malleolus, is relatively loose. Ligament injuries in this case are usually graded like any other ligament injuries from 1 to 3. Grade 1 is usually a sprain or an injury that maintains the integrity of the ligament. There's usually still tenderness and pain, but usually a very minor injury. Grade 2, usually there's a degree of laxity or looseness to ligament testing, but there's a firm endpoint, meaning that the ligament's still intact. Grade 3 usually represents a full rupture where there's significant looseness or laxity and then no firm endpoint when we're stressing the endpoint of the ligament. All 3 grades are associated with pain and tenderness and will depend on the severity of the injury as to what the actual grade and rehabilitation will look like. So I wish LaMelo all the best, and we hope that it's not a severe. Early reports I think I saw were grade 2. That'll determine the prognosis. Obviously he's got injury history as well and the rate of his rehab and return to sport. So all the best to LaMelo. Hope he's doing okay.